Dry mouth on Wegovy, Semaglutide, or Zepbound, Tirzepatide, can feel too small to mention. But sometimes it is the first clue that your body is running low on fluid. The warning is not dryness alone, it is dry mouth plus vomiting, diarrhea, dizziness, or weakness. Dark urine or very little urine after stomach symptoms matters too, especially if it is new. A dry mouth after starting weight loss medication does not automatically mean danger. Many people breathe through the mouth, drink more coffee, eat less food, or use other medicines that dry saliva. The problem is that these drugs can change eating, drinking, and stomach symptoms at the same time. So the useful question is not, what caused every bit of dryness? The useful question is whether the dryness is isolated and temporary or connected to fluid loss. That distinction changes the level of concern. It also changes what you should do next. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs work through signals from the gut that affect appetite and blood sugar. They can reduce hunger and slow how fast your stomach empties. That can help weight loss, but it can also reduce normal drinking without people noticing. This is where dry mouth becomes tricky. If you eat less, you may also drink less from meals. If nausea makes water unpleasant, intake can fall more. You may not notice thirst as much when you are not eating. A patient may think, I am doing well, while fluid intake has quietly dropped. So the concern is not simply the dry mouth. Dry mouth by itself is often not the main side effect doctors worry about. The official Zepbound label reports dry mouth or dry throat in a small percentage of people using it. The official Wegovy label focuses more on stomach symptoms and fluid loss. The warning signal is the pattern around the dryness. Before treating dryness as a warning sign, check common dry mouth causes. Sleeping with your mouth open, antihistamines like allergy medicines, antidepressants, bladder medicines, caffeine, alcohol, and low room humidity can all do it. These causes matter because not every new symptom after an injection is caused by the injection. Timing can separate a medication side effect from a hydration problem. Key timing clues include symptoms after a dose increase or nausea that reduced drinking. Also check diarrhea on the same day or a newly started allergy pill, sleep aid, antidepressant, bladder medicine, or blood pressure medication. The setting also changes the meaning. A hot day, heavy exercise, long travel, or a stomach bug can turn mild low intake into dehydration faster. Dry mouth after a quiet day is one story. Dry mouth after sweating, vomiting, or diarrhea is another story. Context can change the risk very quickly, but a different pattern deserves attention. Dry mouth with repeated vomiting, diarrhea, severe nausea, lightheadedness, fainting, racing heartbeat, confusion, or very little urine is not isolated. That is a possible dehydration warning pattern. That means the body has less water in the bloodstream than it needs. People often wait too long because the symptom sounds minor. Nobody wants to call a doctor for a dry mouth. But kidney stress from dehydration can begin quietly, especially during dose increases. The mouth may complain before the kidneys show obvious trouble. This risk is not equal for everyone. Older adults, people with kidney disease, people taking diuretics, and people on blood pressure medicine need extra caution. A diuretic is a water pill that makes you urinate more. Combining low intake with extra fluid loss can leave less room for error. Diabetes adds another layer because high blood sugar can cause thirst, dry mouth, and frequent urination. Low blood sugar can cause sweating, shakiness, hunger, and confusion. Symptoms need more careful interpretation with insulin or a sulfonylurea. A sulfonylurea is a medicine that makes the pancreas release insulin. Once you know whether someone is higher risk, judge dryness by symptoms, urine, fluid intake, and medical history. Mild dryness that improves after drinking, with normal urination and no dizziness, is usually different. Dryness that does not improve after fluids, or appears with vomiting or diarrhea, belongs in a more cautious category. A practical check starts with urine and standing symptoms. Pale yellow urine and normal frequency suggest better hydration. Very dark urine, almost no urine for many hours, or dizziness when standing suggests a problem. Standing dizziness matters because blood pressure can drop when fluid in the bloodstream is low. Home clues can help, but they are not perfect. A sudden weight drop over one day may be fluid loss, not fat loss. Feeling weak or more lightheaded after vomiting, diarrhea, or severe nausea also matters. If the picture is worsening, do not wait for every sign to appear. Also, look at the mouth itself. Dry lips alone are less concerning than a dry tongue, thick saliva, and thirst that does not improve. A coated tongue, fever, mouth pain, or sores may point elsewhere. Those clues help avoid blaming every symptom on the injection. They also help decide whether dental care or medical care fits better. If dryness seems mild and isolated, simple steps are reasonable. Sip water steadily, not all at once. Use sugar-free gum or lozenges to stimulate saliva. Limit alcohol and excess caffeine, and avoid very salty meals. Dry indoor air may improve with a humidifier. Saliva protects teeth, gums, and comfort during eating. If dryness lasts, tooth sensitivity, bad breath, mouth sores, or trouble swallowing may appear. Those are not usually emergencies, but they are worth mentioning during medical or dental care. When the pattern shifts from mouth comfort to fluid loss, electrolytes may help some people. Electrolytes are minerals like sodium and potassium. They help the body hold fluid properly, but people with kidney, heart, or blood pressure problems should ask before using them often. The same caution applies to water itself. Some people have heart failure, kidney disease, or sodium problems. For them, a clinician may need to set a personal fluid plan. This is why persistent symptoms should be discussed with a clinician, not managed by internet rules alone. Call your healthcare provider for new or persistent dry mouth linked with vomiting, diarrhea, poor intake, dizziness, or very little urine. Call sooner if you recently increased the dose. Also, call if you have kidney disease, diabetes medicines, or blood pressure medicines. If those warning signs become severe, seek urgent help when you cannot keep fluids down. Also, seek help for faintness, confusion, severe weakness, or no urination. Take severe abdominal pain seriously, especially with vomiting. That is not a dry mouth story anymore. That is a broader safety problem that needs to be checked quickly, especially if symptoms are worsening. If dry mouth is not urgent, do not stop Wegovy or Zepbound on your own. Do not ignore warning combinations either. Your clinician may recommend blood tests, hydration steps, delaying a dose, or checking another cause. After urgent warning signs are clear, prevention is simple but useful. Before dose increases, plan fluids, easy meals, and a nausea plan. Track urine, dizziness, intake, and appetite for a few days after dose increases or stomach symptom flares. Dry mouth on Wegovy or Zepbound can be small or serious, and isolated dryness is manageable. Dryness with fluid loss, dizziness, very little urine, or high-risk medical history is a warning. The mouth is not the danger, it is the early alarm. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.